everyone. I'm Julie Thomasis, and I am a board member of Promise Neighborhoods Lehigh Valley and an advocate for marginalized communities in the Lehigh Valley. I want to extend a radical welcome to the interns, the presenters, and the Allentown community to PNLV's Health Equity Fellowship. First, I want to thank the Dorothy Ryder Poole Healthcare Trust and the Ryder Poole Foundation for their support of this program and their ongoing contribution over many years to health equity across the community. The PNLV Health Equity Fellowship is centered in the idea that wellness is a basic human right and that everyone is worthy of a fair and just opportunity to be as healthy as possible. We recognize that there are locally significant obstacles to optimum health, such as racism, power imbalances, and poverty. These oppressive factors, as well as inequities across the social determinants of health, substantially and disparately impact the health and life outcomes of marginalized and vulnerable communities. This is the 6th of 8 informative webinars. Each webinar will have 2 presenters and cover key social determinants of health. The webinars will last for about an hour and a half. The presentations will be followed by 30 minutes of Q&A, and the webinars, as Ola said, will be recorded. Our presenters are both experts in their field and leaders and representatives of our community, and they're going to share with you the inequities, the challenges, and the opportunities in our health system. My reminder to you today, as on every Monday webinar, is that knowledge is power. Our webinar topic is managing chronic disease in the community with Jessica Renford, registered nurse, and Yahaira, Washington community member. And you've met Ola, and she is our Health Equity Fellowship Project Director. It'll facilitate the Q&A. And I'm going to start by reading you the bios of our 2 presenters. So Jessica Renford, née Rodriguez, is a registered nurse by National Council of State Boards of Nursing. She earned her position as RN clinical coordinator at neighborhood centers of the Lehigh Valley in their Bethlehem site, and she's been there since July 2016. She oversees the site on a daily basis, as well as empowering her staff to understand the purpose of helping the patients learn how to manage their care. Prior to this position, she was a case manager infusion nurse for Caregivers of American Home Health for 3 years. She was able to start the patients with their care plans after they were discharged from hospitals and sat with families in assisting and educating them in their disease process. While in her final practicum before finishing her nursing degree, she did her last semester in the emergency room at Sacred Heart Hospital in Allentown, where she landed her first position right out of nursing school. And the ER taught her the best critical thinking skills, which helped her care for her patients even today. From an early age, she knew she wanted to work in the healthcare field, and she would always help others. She has this advocacy about her that fuels her passion in caring for others, especially the community that's in need. She received her Bachelor of Science in Nursing from Cedar Crest College in Allentown. She currently resides in Macungie with her husband and 3 children. And her next journey is to take mission trips all around the world to give back her knowledge and capabilities of making the impossible possible. Her favorite quote is, "I learned to give, not because I have much, but because I know exactly how it feels to have nothing," by Rohit Sharma. That gives me the chills. Thank you for that. That was beautiful. Thank you so much. And now I'm going to read you Yahaira, Washington. Yahaira is an activist, an advocate, and an engaged member of the Allentown community. She grew up in Center City in a big family and her childhood was often challenging. She sometimes found her family homeless, and the family suffered the impact of drugs, lack of jobs, and the accompanying poverty. Her father left when she was 7 years old, and everything fell apart. Her mother became involved with drugs. When she was 17, Yahaira decided that she needed to leave that life. She left home and got a job. She briefly found herself in an abusive relationship. Some years later, she met her current husband, and having children changed her life. She dedicated her life to her children and continues to do so. When she was about 30, she began to suffer a number of diseases, including overlapped connective tissue disease, lupus, morphea, and I don't know how to pronounce this, dermatomyositis. The diseases have brought forth epilepsy, which has resulted in ongoing seizures. And, you know, as we're talking about chronic disease and how it affects people in the community, this had a profound effect upon her family, especially her children, who live in terror of her going into full seizure. Her seizures can be provoked by any kind of stress, which interrupts her activities with her community and the family. Luckily, Yahaira has medical coverage through her husband's private insurance. She feels that if she was on Medicaid, she would not have the quality and responsive medical care she needs. Despite the affordable care, she still feels the stigma of being a Hispanic woman. She feels that she's looked down upon as a Latina and is very much aware of negative attitudes towards minorities within the healthcare system. Despite these drawbacks, she is an engaged mother of 3 children and involved with the Allentown School District. She is an avid parent, student advocate for all families within the school district. Her focus is empowering families to make their voices heard and interrupt the school to prison pipeline, helping to make sure all students have the opportunity to achieve their potential. Thank you so much for being with us, Yahaira. Okay, Jessica, you're on.
Self here. Okay, can everyone hear me?
Yes.
Okay, so I want to first thank Promise Neighborhoods for hosting myself and Yahaira. I just wanted to talk briefly a little bit as to what I do. I know in my biography, as Julie stated, I am an RN clinical coordinator, but I wanted to allow everyone to understand exactly what I do on a day-to-day basis with our community and our patients. So what I do is I oversee the daily operations. So when patients come in, I want to ensure that they're getting the quality of care that they deserve, regardless of who they are. I work for a federally qualified company where we don't turn anyone away, regardless if they have insurance or they don't have insurance. We have this sliding fee scale. I'm not sure if anyone's familiar with neighborhood health centers of the Lehigh Valley, but we have a sliding fee scale where we go off of a patient's income and household, how many people live in the home, and that's how we determine their copayment. Sometimes they have no copayment and they're able to see their doctors, and counseling, we also have that on site. So my job is to ensure that the patients come in, they get seen, and they leave here happy, and they leave here with exactly what they came in for. So a prime example is if a patient comes in and they're just having their physical done, we ensure that we address every concern that they have, not only just a physical, right? Because the provider will take them back to a room and then end up seeing other things during their visits. So my job is to make sure that I link them up, and I link them up with the resources, and I connect them with our team base. We have a team-based model where we have a care navigator, we have social workers on site, we have even OB care. We have a little bit of everything. So a patient doesn't leave here when not knowing what they have to do, their next step. So that's a little bit as to what I do. So my job is to ensure that the flow doesn't get interrupted, that the patients leave here happy, and that they understand their care plan before they leave. Another thing that I do as an RN, not as a clinical coordinator, is I handle a complex care panel where I get to see patients, like I actually get to sit with the patients. I'm not all administrative. I also have face-to-face interaction with patients, and I get to see them for about an hour. And I get to do motivational interviewing. I'm not sure if everyone's familiar with that. It's called the Flinders model, where it's almost like we find what motivates the patient most, whether it's health related or not. We find whatever it is that it motivates them to then get them to address their health concerns and know how to manage their care. So it's one of those things where I actually get to sit down and get to learn the patient as a whole. And sometimes they open up and sometimes they don't. But this way of interviewing allows them to open up to where I get to understand where they're coming from and why they're not doing the things that they're doing. And we try to then connect them with whatever they need. And then they come back to me, and then we start addressing their care plan and start tackling one thing at a time, so then we can be able to guide them and navigate them through their chronic illnesses and connect them with their specialist and do whatever it takes to get them to manage their own care. So that's a little bit about what I do. And I'm gonna give it to Yahaira so she can talk a little bit of what she does for the community.
Okay. Can everyone hear me okay? Wonderful. My name is Shahid Aviles, Washington. First and foremost, I'm a mom. I'm a mom of 3, actually 5. I have 2 stepboys. They're a little bit older. Currently in our district, we have 3. I'm a parent and a student advocate within our school district, the Allentown School District. That journey began roughly 8 years ago when our daughter entered kindergarten. And I say battle because it's been a very hard uphill battle. You know, I know this is a health and chronic disease situation, but it all really stems from the same types of issues, disparities within our communities because of the Black and Brown. So, you know, that trickles into our school district as well. My time battling with the school district has led to my knowing other leaders and other challenges within our community. And I've been blessed to sort of work with many of the great leaders within the Allentown community. Dr. Hassan Batts is one of them. Ms. Julie Tomasis is another. I absolutely love her. And thank you for providing this space for me. That's all I have. Free to answer any questions.
Back to you, Yahaira.
Thank you.
I say.
Do you want to share the PowerPoint, Yahaira?
Okay, we're going into share screen mode. Just bear with me. We did practice this before. So I should be up and running, no problem. Can you guys see?
Not yet.
Oh God, I take that back.
That's okay. Take your time.
We got this. Oh, there we go. Now, can you see?
Yes, ma'am.
Okay, perfect. Just move this out of the way.
You're welcome, Hassan.
Okay, now Ola will be handling, as previously stated, any questions through the chat box. I will man the PowerPoint presentation and Jessica will do the actual presentation.
Excellent teamwork, ladies.
Hey.
You can go to the first slide. So we're going to be talking about chronic diseases in our communities. So chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both, per the CDC. So some of them are diabetes, heart disease, stroke, asthma, epilepsy, cancer, lupus, arthritis. I can touch a little bit of each and every one of these as an RN, as my mother being a diabetic, managing diabetes. A lot of the patients that come in here that are diabetic, that don't have insurance, we try to set them up with their care manager to try to get them on to to apply for insurance, as well as, we do get a lot of diabetes medications that we get from our providers that are samples, and we try to bridge our patients as much as possible until we get them on board with some type of insurance. In regards to asthma, the same exact thing. We try to encourage our parents and educate our parents in regards to asthma management, and we go above and beyond to try to help with that as well. Epilepsy, cancer, lupus, and arthritis, they're all chronic illnesses, and they all take a toll on a lot of families and patients, and a lot of the times we just try to address them as a whole and not just write them a script and expect them to be able to manage their care. You can move on to the next slide. So 6 in 10 adults in the US have chronic diseases, and 4 in 10 adults have 2 or more. Racial and ethnic minorities are 1.5 to 2.0 times more likely than whites to have most of the major chronic diseases.
Wow.
You can move on to the next slide.
Just real quick before we do move on. A part of that, part of the reason to that, again, goes back to the disparities. I don't know if everyone was able to see the TED Talks that was in correlation with this, sort of talked about how stress affects our well-being. And, the stress factors within the minority community is grand. That's all.
Thank you, Yahaira. I'm just going to go off of what Yahaira just said. Racial and ethnic disparities in our healthcare system. As you can read here, racial and ethnic minorities tend to receive poor quality care compared to non-minorities, even when access-related factors such as insurance, as I stated in the beginning, and income are controlled. The problem of racial and ethnic healthcare disparities is highlighted in various statistics. These are some statistics. Minorities have less access to healthcare than whites. The level of uninsurance for Hispanics is 34% compared to 13% among whites. Native Americans and Native Alaskans more often lack prenatal care in their first trimester. I see this firsthand. Nationally, minorities, women are more likely to avoid doctor visits due to cost. A lot of moms, as you know, they have to care for their children. And of course, mothers always want to take care of everyone else and forget about themselves. Mm-hmm. So we see that a lot coming through our doors here. They come in for their children, yet they're battling a lot of chronic illnesses that they can't even manage at the time because they're worried about their children, and of course, and about the cost because their children's come first. Barriers are communication difficulties, provider stereotyping, and cultural barriers. That's something that, I see firsthand. So you can move on to the next, unless you want to touch on that, Yahaira, I'm not sure.
No, thank you.
Oh, you're taking over. You're taking over the next 3 slides.
What? Okay. Now, some factors within Black and Brown communities. Systemic racism is the institutional racism, also known as systemic racism, is a form of racism that is embedded as normal practice within society or an organization. Health disparities, a difference in which disadvantaged social groups such as the poor, racial, ethnic minorities, women, and other groups who have persistently experienced social disadvantage or discrimination systematically experience worse health care or greater health risks than more advantaged social groups. Accessibility, healthcare, insurance, private versus Medicaid, transportation, etc. Knowledge and education, lack of or inability to access a proper education. And ultimately, money and resources. Money equals resources. It's kind of sickening. How to help yourself manage chronic disease. And I'm saying this as an individual with chronic disease, as a mother, as a wife, as an advocate. These are things that I had to learn about myself. And to be very honest with you, I continue to learn every single day. One of the biggest things is learn to listen to your body. Self-love, love all of you, especially through the hardest times. Set healthy boundaries, learn to say no, and don't apologize for having a chronic disease or for being you. It's okay. Education, illness, nutrition, opportunities, resources, and again, etc. Education is not just one single thing, you know, that when you have a chronic illness, it's not a pamphlet that's going to be handed to you that says, here's everything you need to know. It ultimately is everything. You have to learn about your illness. You have to learn about what triggers certain things. You know, if you change your nutrition, is that going to help you? The opportunities that you have because of the illness, in terms of maybe getting to know other individuals that you may not have crossed paths with because of the illness. And that ultimately turns into resources, networking, and that sort of thing. Standards. This is a huge one, and this applies to medical as well as your personal life. Because ultimately, stress is the main factor for most of these illnesses, diseases, chronic factors. Is never tolerate anything or anyone who makes you feel uncomfortable. It is your health. Your atmosphere affects all of it. Set standards and accept nothing less. Help. Learn to ask for and accept help when needed. Access the resources provided within your local community, such as Promised Neighborhoods of the Lehigh Valley and Neighborhood Health Center of the Lehigh Valley. I found that personally to be one of the hardest things, is to ask for help and to accept help. Oftentimes we're surrounded by an incredible support system, and learning to accept the help is critically important.
So I'll touch base on this. I'm just gonna, how to help yourself with managed chronic diseases. Find a primary care provider that will listen to you and help you take control of managing your care, just like I spoke about as what we do at neighborhood health centers. St. Luke's, Lehigh Valley, there's all the networks around us. Just find and know that you feel comfortable, and it's very hard. I've come across so many patients that say, you know, they have to decide on who their preferred primary care provider will be. And it all depends on who they make the connection with, who is willing to go, you know, the extra step to ask them how they're doing. A lot of patients, I do ask them after their visits, how did their visit go? Did they like this provider? Because this is their first time coming in as, you know, establishing care with us. And a lot of the times there's patients that will say, no, I don't think that's the great fit for me. Can you, you know, my follow-up appointment, can you put me on with somebody else? And if I have a discussion with the patient, I kind of know who to place them with depending on what their chronic diseases or I just have a good sense of how to do that. And then usually their second time coming around, they're like, oh my God, thank you, Jessica. She's like the best provider ever. I want her forever. So it's one of those things where it's nice. It's nice to see. Motivational interviewing is what I mentioned in the beginning. I put it in the slide, but I should have not put it in here, but it's something that I'm passionate about, and it's something that I started doing with neighborhood health centers, and I'm certified to do it. And it's been an amazing outcome. The things that I am able to do with patients, you wouldn't even believe. Like, we have so many resources, and patients are like looking at me like, how did you even make that happen? And it's just, that's what's rewarding about my job. At the end of the day, it's not, you know, overseeing the site. It's not doing any of that. It's me sitting with my patient and being able to connect with them and being able to assist and help them in managing their care and being able to just take that 10-pound, 20-pound weight off their shoulders. I always encourage the patient to educate themselves in their disease. Like Yahaira said before, education is big, and getting to learn and know how to manage their disease process, and ask doctors the questions. You don't understand how many patients come in, and by the time they're checking out, they're like, I forgot to ask the doctor this question. I'm like, what is your question? I will have them go right back in the room. And sometimes I'm able to do that because I know this is important to the patient. And these are things that I try, even when we're scheduling like a complex care appointment, I try to have the patients write down as many questions as possible. Some patients just feel that they shouldn't have to question a doctor sometimes. And I think for me, that's that like is shocking, because it's your care. You should be able to feel comfortable in discussing anything about how do you want to manage your care. It shouldn't be a doctor telling you how you need to manage your care. It should be you saying, this is what I can and cannot do, and can we develop a care plan around, individualized care plan around how I manage my chronic illnesses. Take control and stay consistent in managing your care and individualize, like I just stated. Share the knowledge with others that may be going through what you're going through. I always encourage patient, and you would be surprised on how many referrals we get word by mouth, that they're, oh yeah, they told me you got him with this doctor, I need to get in for this doctor. And that's how we see a lot of our patients as word by mouth, and them talking to each other and them saying how great we are and how we manage their care. I always encourage a lot of providers, a lot of nurses that I come in contact with. We all have to care for one another regardless. We're still human. Yes, I'm a nurse. I am a mom as well, as Yahaira stated, mom first. And I'm an advocate for my kids. I'm an advocate for anyone. I treat everyone like they would be my mother, my father, my kids. We all deserve the same care that everyone gets. I think they deserve the same quality of care, regardless of what they make, what they have, what they don't have. That's one of the things that I love to share, and I love to have everyone jump on the same wagon with me in regards to that. And I try to encourage my staff to just have a big heart. So you'd be surprised on how many healthcare providers are just, healthcare providers, nurses, any medical assistant, any, front office staff. They're just like, okay, this is a job, but it's not a job. These are people, these are humans. We have to manage them just like we would manage our parents, our loved ones. And just love one another. So you can move on to the last slide. I think this is the last slide. I'm not sure.
1 second. There we go.
I know they told us this would take like so long to present. And I took this, and I know if you watched the TED Med, I took this, We Are the Movement, because that really touched me when, Nadine Burke stated, we are the movement. We are supposed to be the one encouraging one another to make a difference. Let's try and remember that we're all humans, and we should love and care for one another and learn to advocate. We all know our rights. We all know what we're supposed to do for one another. And if you see something that's not right, stand up and say something. It's not, like I said, just care for one another at the end of the day, regardless of who you are. And, our jobs are not to judge. Our job is to care for one another. And that is my ending to the PowerPoint.
Empowerment.
Absolutely.
Teamwork. That's what it is.
Yahaira, you're amazing.
Teamwork, baby, teamwork. As are you.
So I'll leave this platform for any questions from anyone that would like to ask any questions to Yahaira or myself.
I have a question for Jessica.
Yes, ma'am.
So I myself have suffered with chronic illnesses for about 27 years, and I'm only 41. And
Oh, wow.
You had said when you're not happy with your primary care physician, to move on. One of the things I do is advocate for others that don't have a voice when they go to the doctor. So let's say I'm not happy. How do we understand what is happy? Because sometimes, we all go to WebMD or do different Google searches, and there may not be, I have currently diagnosed, I think, most of my conditions by me doing research, by me speaking to other people in the community like Shahida. Sometimes you can narrow it down. Well, I don't have what she has because I don't have this and this and that, and then you present it to your doctor. Where can we advocate to people to say, okay, it's a medical failure, or it's just, you have something like many of the chronic illnesses that I suffer from are not always diagnosable. They're a process of elimination. Like I suffer from narcolepsy. So it took them about 5 years to discover that I had narcolepsy before they could actually understand that. I have polycystic ovarian syndrome, but I have 3 kids. So at the same time, they figured I didn't have it because I'm fertile and can have children. So I had to do a process of elimination. So where does a person realize the doctor is the problem, or it's just that science hasn't come up to date, or they're not where the illnesses meet? How does a person figure something else out like that?
That is a great question, because I have that even my coworkers are going through that. We all go through that. I think is finding, like I said, you have to make that connection with your doctor. And when you have that many complex or chronic illnesses, you want to see a medical doctor. I'm not like undermining any nurse practitioners or any of that nature, because they're amazing. But when it becomes so many things that you're having so many symptoms and so many, you want to be able to see a medical doctor. And you know how you Google and you went on WebMD, there's ways that you can Google medical doctors at whatever practice you're going to, and you can actually see what their expertise is. You know what I mean? What they're good at, what they've worked on. There's a lot of doctors that have written research papers, and that's kind of a way where I educate a lot of patients depending on, you know, what they're dealing with at the time. But a lot of the times you won't know. It is a process of elimination. Unfortunately, that's just how the healthcare system is. It is amazing when you do come to a healthcare center or a St. Luke's network or a Lehigh Valley network, and you find a good doctor and they're able to understand you and they're able to trust your judgment in your own care. And that's when you start having a better access to your care and better understanding with what you're going through, and you feel like your doctor understands you.
How can somebody ask for a doctor without, like, I love my nurse practitioner because through me, she's been able to help me diagnose my children who have similar conditions. You know, it's made it easier. So we all share the same doctor. But sometimes I do feel, and I don't want to be offensive to her because she's been well, but at the same time, we need to get to the next level. How do we go about that without offending her personally?
Oh my God, no, you won't, because you know what, I don't know where you go or where you attend, but
I go to St. Luke's.
So you should be able to ask, can I see a medical doctor? And then once the medical doctor figures out what my situation is and gets my care plan in place, then they can transfer you back to your nurse practitioner. That's how they're supposed to be working anyways, as a team, because that's what we do here. So when a nurse practitioner feels like it's too much of the patient, like where she's running into a wall and she feels like, I need somebody to oversee this and I need somebody's judgment to help me out in dealing with this patient, they're supposed to have that teamwork and communication to where they're referring their own patient to their medical doctor. And their medical doctor is just seeing what the nurse practitioner has been doing for so long, and then maybe it's almost like getting a second opinion. Unfortunately, you're going to want to have more eyes on your care, especially when you're dealing with so many illnesses. You want as many eyes as you can, because you want different opinions, and different doctors practice differently. And I've known that firsthand because I work with a lot of amazing doctors here, and they go above and beyond in trying to figure out what's going on, and they send you for so many tests, and sometimes then they have to go above and beyond themselves and go to our medical director. It goes as far as that, because that's who their resource is. So please don't feel like you're going to offend her in no way. That's just, remember, you want to advocate for yourself. This is important to you. So you want to ensure that you're getting the care that you deserve.
And I'm asking for myself, but a lot of times I go to the doctor with elderly people or different people that don't communicate well. It's not even a language barrier. It's just a comprehension sometimes barrier. So I want to be able to understand when I go in them for them, because sometimes some of the doctors, you know, are, I have a PA-C. That's what my doctor is. I don't even know what she is.
A physician assistant. So she practices underneath the doctor.
And I've never seen a doctor, and I think I've been with her for at least 22 years now. I've been with the same, I think right when she was still an intern, she was my, my medical professional, because you never know what they are anymore. But I want to learn how to advocate for other people, because I know about my condition, and she may be good for us, but somebody with something else, she's not so great with. So I want to understand how to help communicate for the people that we do take in. Right now, I have a gentleman who has, he believes he has psoriasis, but I suffer from psoriasis, and we've gone to 15 dermatologists already, and nobody's getting an answer. But it's like you said, I think it's because we're not getting a doctor to see him, so we're not getting an answer.
Yeah, and just to clarify, a physician assistant works underneath an MD or, you know, a DO. So they have to actually review their charts, and they have to actually oversee what they do all the time. So I don't want you to think that a medical doctor is not overseeing your conditions and anybody else's conditions, because they're supposed to always review and actually have conversations with their physician assistants. That's how they practice. But in regards to like the psoriasis patient and stuff, yes, they should be getting in with a doctor. So maybe just to get a second opinion, and maybe they will send them to a different dermatologist, or maybe themselves they can send a certain puncture. It's like a puncture sample, you know, of their skin,
Biopsy,
and then
sure.
we send it to the lab. We send it to the lab. We do that here. We send that to the lab if we know that, you know, they've been to all these dermatologists and they're not getting anywhere. We do a puncture test and we can do that. So yeah,
I hate to go and be the next one hogging the questions, but how can
no, please keep them
how
coming.
can somebody so I've asked for two of the people that, you know, come, they come to us saying, listen, I've gone to the doctor and I need help. And I have one guy who actually went to the street for, I want to say, medicine. Like, he was in so much pain from the itching, the scratching, the scars, that it's gotten so bad that he went to the street, and we actually met him at one of our relief drives, you know, because he couldn't take the itching and pain anymore. I went with him, well, not myself, my husband went with him to a doctor's appointment, and they kind of tried to insist on getting some kind of, you know, swab, and they were, I don't want to say ignored, but are you allowed to request that? Or is this something that people can demand? Can I say, I want a swab, I want this test done?
No, I mean, you can, right? So my thing is, if whomever he's going is not working out, I would switch. I would switch to another practice. I would switch to another primary care provider. I would get another set of eyes on his skin. And I mean, that shouldn't happen. He shouldn't have to go to the streets to get any kind of relief. We have so much resources out here for that. It's just a matter of getting that right nurse practitioner or medical doctor to see him and actually try some, you know, creams or medication. If it doesn't work, then guess what? Call back in 24 hours, get a hold of myself, one of the nurses on site, and the doctor will communicate that with me and say, we have to keep an eye on this patient. Please follow up tomorrow to see if that cream is working. If not, I'll send something else. So it's a matter of managing and staying on top of our patients that we have to do. And unfortunately, I feel bad for him, but that he shouldn't have to be going through that. And that's a prime example right there.
And
I'm not going to ask no more, but
well, hold
do
on.
they treat addicts differently? Do they not diagnose them and give them medicine when they have tendencies to have drug addictions? Or because often they get judged for being addicts, and I know they're sometimes not, but do they get treated differently? Is there a protocol for allowing them to treat them differently?
Absolutely not. There should never be, no one should ever be treated differently. Again, I can't speak on doctors that have their own personal judgments or anything against anyone that's a user. I can only speak on myself and how I care for patients here, but I have seen firsthand when I used to work in the emergency room and in other practices, I have seen it firsthand where they do get treated differently and they do get judged off of, you know, doing drugs. That's like a stigma almost to them, you know, and it's unfortunate that that's where we live nowadays. And it is sad, but yes, that does happen. And I've seen it with my own eyes.
And Jessica, to touch base on that, you don't even have to be a drug addict to get that treatment. I have gone into the emergency room as a Hispanic woman, and it is clearly noted on all of my medical charts. I take absolutely no narcotics, and I have been treated as if. Now, one thing I do want to say in terms of everything you were just speaking of is we don't live in a bubble. You don't have to limit your care to Allentown, Pennsylvania.
Correct.
I can tell you personally, there are a number of times I have asked for a solid referral to UPenn Medicine because I felt that they were able to go a little bit above what my current providers were able to go for. I demand, I do not ask, I demand for my doctors to be an absolute team. And if ever I feel that, I don't know, I'm not liking the treatment, I go elsewhere. This is my health. This is my well-being. And when our body speaks to us, we must listen. And we must learn to be our best advocate. And if we don't know how to be our best advocate, reach out to those of us that know how to do it so we can empower you to go ahead and continue with the best treatment, the best healthcare plan, the best everything that surrounds your world.
I love that. I just had I was interviewed by OLA students last week, and I kind of explained to them how healthcare differs when we go others. I go to Northampton a lot, to the St. Luke's over there, and I get treated very differently than I do here. And I appreciate that, Yahaira, that you say that, because I have demanded, my foundation is currently working on giving free transportation for those who live in the community who rely on center city treatment because that's all they can access. So one of our things is we're trying to get a van to maybe take people to have other appointments and kind of get them there so that we can let them get that treatment elsewhere. That is sometimes a little better quality. The waiting room is cleaner. It's not so crowded. So I love that you said that, and I'm glad that I'm not the only one who feels that way.
It's your health.
Absolutely.
Any other questions, comments, anything?
I have a question. As an upcoming nursing senior who's like about to take their boards and become a nurse, how can I help community or members in my community outside of just that hospital visit that like I see them like once every 5 months?
I would encourage you to know your resources wherever you're going to work. Know who your resources are, who your advocates are around the area, right? Because I've worked in the hospital as well. And when you see patients, a lot of the times you feel like your hands are tied, right? Because you're just doing so much, but then you want to do more. I know how that feels.
Yeah.
Trust me, I know exactly how that feels, where you want to just know, why is it that they can't afford their meds? I want to know everything, right, before I send them home. But that's why you have a team in the hospital as well. You have your care managements that are in the hospitals, there, you know, your discharge planner, you know, you can always be involved in that as well. And just, you can always advocate for your patient. That's your patient as an RN. It's your patient at the end of the day. Your signature is going to be on that chart. So I always encourage a lot of nursing students coming out of nursing school to understand the responsibility you're taking. And once you take that oath, you are responsible for your patients as a whole, even if you're just treating them just for that time being. Just ensure that you know that you're passing them on to somebody that's going to take care of them. And sometimes it doesn't hurt to say, hey, so what happened to that patient? Did they get follow-up care? And that's usually what I do. I encourage a lot of nursing students to do, because I was in that position. I know exactly where you're coming from.
I love that. Thank you. I've never, because sometimes it's hard. You're like, I really want to do more, but what can I do? But that's awesome. As you said, everyone should work as a team, and there are people that can do a little more, and it's great to follow up. So
yeah,
thank you. I'm really going to keep that in mind.
Yeah, absolutely. And you can feed off of that team. You can learn. You can be your own resource as well. And sometimes you can just go in and just teach the patient something. Like you're not constricted to just be a nurse. You can be a little bit of everything as a nurse. So just keep that in mind.
Thank you.
Yeah, absolutely.
Thank you for asking that awesome question. You care. You're going to be
That's
amazing.
right.
Oh, it's too quiet in here. Ask away.
I just wanted to bring you guys' attention to the chat. There's a couple conversations going on here. So Carolyn Hoffman said to everyone, Jessica, I'm more than happy to help you navigate being an advocate. I do that for my seniors at Senior Helpers. And as you know, when I was with Oath and now with VAST, call me. So, I mean, I think that's cool because we're identifying some additional resources in the community. So for this, I know the students are on this call, and some of them are working on a project of putting together tips and resources for the community. So you're hearing some names of people who, Carolyn, if you feel comfortable to like share your email or any contact information that you have, if you feel like the students can, the students can add you to their presentation or information that they have, if you feel comfortable with that. And if you want to provide any further information about Oath or VAST for those of us who don't know what that is.
Sure, I absolutely can. So I know I haven't been on these calls. I've been trying to get my work-life balance here going on. My paying job, it takes a lot of my time. I work in the senior community. I've been a nurse for 25 years, something like that. So I've been well seasoned through My specialty has been geriatrics. And I don't know, I think it was 6 years ago that I first met Hassan, and through his trauma training. And so it piqued my interest in community, nursing community, just involvement overall. So then I got involved with Operation Address the Homeless, which is an outreach and a drop-in center on 7th Street, 221 North 7th Street. They have a program Monday, Wednesday, Friday, 4 to 7. They do feed and shower, clothing. The homeless individuals, they do go down to the tent city and help them down there. So when I decided to kind of hyper-focus my area of something that was very personal to me, and I had the opportunity to speak with Catherine over at VAST and deal with survivors of sex trafficking. So that's where my focus is now, and I'm working on training prevention. I'm actually attending this week also a international summit on sex trafficking, and learning a lot about that, and also, you know, the staggering numbers and statistics of marginalized communities, and you know, helping women of, you know, Black and brown communities who are not able to get the resources to get out of those situations. So I have a lot of contacts. I know how to navigate a lot of the system. I've become a very vocal advocate for all of my patients. And my mother, unfortunately, has been going through the hospital systems, and being a geriatric nurse and seeing what goes on with my seniors, and dementia and cognitive impairment, especially. There's a lot of things that are wrong. I have sat in front of boards, and I have asked them point blank, have they done studies on how many seniors they kill every year? Because there are just very small common sense things that I see that, because nurses on the floor are so busy, you know, your patient load is ridiculous, and we're not looking at the human aspect of the person we're dealing with. We're not treating them as a whole, and you really have to. You know, so now with my mother going through it and things happening to her, unfortunately, she was in the hospital during the start of COVID, and I couldn't be there. And me not being able to advocate for her, and her being on life support system, that was really difficult. And it got so bad that I became extremely vocal, to the point where I got a phone call from the president of the hospital.
Right.
But I will never, ever shut my mouth if it is the right thing to do for that person. And I don't care, how shall I say this? I don't know if there's any PC way to say this. I don't care. I don't care if you are Dr. Nestor at Lehigh Valley Hospital. I don't care if you are the CEO of St. Luke's. If you are doing harm to my patients, I will speak up for them. So with working with Oath and with VAST, and you're dealing with, you know, PTSD, your addiction, mental health, you know, just all kinds of traumas, you have to have that advocate that's going to be able to speak up and understand how the system works. And when you get to know how to navigate the healthcare system, then you know how to leverage things to work for your clients and your patients in a better fashion, because things have changed so much since I became a nurse, and things are so way different. Like before, I used to be able to, you know, call the primary care doctor who was the doctor on the floor in the hospital. Now we got hospitalists and specialists, and we got like 70 people seeing somebody, and nobody talks to each other, and things get missed. So put that in perspective with, you know, anybody out of the community who has an addiction or mental health issue, and you're just going to put them in the hospital and pray to God that they're okay, and they may not be understanding what is being said to them, you know, or what kind of testing they're talking about, or even be able to agree to it, and a doctor's just going to accept a yes without going deeper and finding if they are able to even agree to a test? You know, what's the comprehension level? Are they able to make that decision safely and soundly? So, you know, I am always available for anybody. And Jessica, you can put my information out to whoever.
Oh my God, thank you. No, that's
Yeah,
going to be
so-
added to my resource book. Absolutely. Thank you.
Yeah.
Absolutely. I know we need all the help we can get, especially navigating our patients. It is a challenge. It's a challenge every day for myself. And I wish I can do more, but as you know, my job takes me away from having to help so much.
Yes.
But eventually that's something that I'm passionate for, especially when you first go into the emergency room. I know exactly how that works.
Yes.
So I try my best. Everyone that knows me and goes into the emergency room, they're on the phone with me before they even enter that emergency room, just to see what is it that how they're supposed to be treated and what
Right.
they're supposed to ask for. Like, I try to be available as much as possible. But I can completely agree with you 100%. Yeah. Thank you. And thank you for sharing.
Very welcome. Very welcome.
Something that I, as a non-RN, as a I don't know, someone who's not in the medical field, the biggest thing you can do for me and for every Black and brown patient that comes through your doors, or not, just every patient in your community, is, and excuse my word, and Ola, everybody plug your ears if you're a little sensitive, but it's call out the bullshit. Systemic racism, it's real. There is no denying it. And when you're silent, you are complicit. That does not change if we're in the streets marching, or if, you know, I'm laying on a bed and you are my nurse, and you know that the doctor who's about to come in is a racist. That shouldn't even be a doctor, because it's going to affect my care. I'm going to share with you guys a very specific instance. It wasn't too long ago, and the manner in which it affected me made me realize, number one, the strides that I've come from when I first was diagnosed to now, and the heartbreaking reality that no matter where I am, how vocal I am, or what is going on in this current world, racism is something that we face every single day. And okay, so I had to go into, I have epilepsy. I had to go into the epilepsy management unit, and I'm just going to call it out. It was St. Luke's Hospital in Bethlehem. It was the 7th floor. The individual I'm speaking of is Dr. Chris. He's supposed to be supervisor of the floor. My stay was scheduled to be anywhere from 3 to 7 days. The purpose of my stay is they wean me off of my medication. They try to induce the seizures to see where exactly they're stemming from. I do have an anomaly on the front right portion of my brain. We're thinking it's from there, but that was the purpose of the entire stay. I checked in, everything was wonderful. A few hours later, I had taken a nap in the bed. I wake up, I'm looking at the bed a little bit more in detail, and I noticed that the bumpers that are supposed to protect me when I go into seizure mode, they're filthy. They're cloth bumpers, and they were really dirty. Like, I was able to wipe crud off of them with an alcohol wipe. So I had asked my nurse about it. It turned into this huge thing. It got to the point where I said, okay, excuse me, either I get what I have an absolute right to, which is a clean, sanitized area, or I am going to sign myself the F out. I guess because I said that, someone must have felt threatened by me. And they called this, yeah, really. And they called this individual in. This individual did not knock on my door. He did not ask if he can come in. He did not state to me who the hell he was. His demeanor was very authoritative, and he was there to make it very clear that he was in charge. I asked him who he was. He told me he did not have to tell me his name. Anyway, I ended up I told him to get the hell out of my room. I called my husband and I told him to come pick me up, and I signed myself out of the hospital. There is no way in hell I was going to spend 3 to 7 days in a hospital where, number one, they can't even provide me with clean, sanitized area. It obviously became a problem. And number two, if that is how you are handling such a simple situation, what am I to believe that you are going to take care of me in my most vulnerable state?
That's right.
You know, how do I know that you're not going to leave me laying there for 30 minutes after a seizure with everything that happens to me, and when I have a seizure? It's just, it was
an eye-opener.
Not even an eye-opener, because I knew it existed. I just couldn't believe that it was so blatantly in my face. Correct. And the anger that I felt, like, I punched some things when my husband came to pick me up. That stayed with me for 3 days. My body felt that anger and just every single muscle within me, everything in me. And Julie, we spoke a little bit, during that time. Everything in me was hurt. And I say hurt as in heartbroken. I say hurt as in this is 2020 and we're really still dealing with this mess. I say hurt as in, damn, my husband pays a whole lot of money for my, medical insurance, and I'm really having to deal with this. I say hurt as in, why am I having to request to go now to UPenn because the individuals that are within my realm of care can't provide the care that I need? Why do I have to demand this? Why isn't it just automatic? Thank you for listening.
It's frightening. It's frightening.
It absolutely is.
I just say, oh, go ahead.
I'm sorry, Ola. I just think that just shows how broken the systems are. You know what I mean? Like, that just points out, and you're not alone in your experience. And I'm sorry you felt that way. I had an instance where I had a nurse trying to get a psych eval on my mother, and my mother has no cognitive issues. They gave her a medication that caused some behaviors that were not normal, and she ended up in somebody else's room hallucinating. And they tried to get a psych eval, and I threatened them with a lawsuit. I said, yeah, absolutely not. And I've used very colorful language at times, and because I was so mad, that's the only way I could get them to listen, is like, you're not hearing me. She's been misdiagnosed with sepsis. She never had sepsis. It was her cancer that returned. They will not take that diagnosis off because then they admit guilt. So working within the healthcare system, I see that broken system, and it just trickles down into everything else in the outlying areas. We're looking, we have the what's going on right now with the police. That system's broken. I have been in, unfortunately, family court for almost 4 years now. That system is beyond broken. And being in this summit for sex trafficking and learning what foster care does to children, I mean, I'm like, all these systems are broken. How do we fix it? How do we fix it? And then we're talking about also the marginalized communities. How do we save, the Black and Brown communities, who are the biggest recipients of the broken system in not a good way? It's overwhelming at times. So
And this is why Promise Neighborhood exists, right? Because we want to be all advocates. We all want to advocate, and we all have to start educating our generation, right? our generation coming up now, our nurses, our brand new nurses that haven't even taken their boards yet. We want to make them understand that this is still there. They're going to face all these challenges, and we have to empower them to learn and to be able to stand up and be advocates for their patients, because the more nurses that are advocating for their patients, I guarantee you, little by little, things will change. But if you have nurses that are just taking orders and doing what
Right.
a doctor tells them to do, even though it's wrong, then we have an issue. We're never going to fix the system that way. You've been a nurse longer than me, so you know where I'm talking about. Oh no, that's what the doctor said. I don't care what the doctor said.
I know I've had doctors scream at me because,
Absolutely.
I wouldn't listen to them. And I documented it in the chart because I'm like, this is a illegal document. So if it comes back, it's not coming back on me. It's coming back on you.
And we need nurses like that. We need more nurses that are coming out of nursing school to be advocates and to empower other nursing students. Even myself, one of my goals is to speak to colleges and nurses, coming out of college. Like, it's not what what you're learning is in black and white in nursing school. They teach you in a perfect world. And when you get out into the real world, you're like, what the heck? This is not what I learned.
Right.
So it's almost like you have to be aware of your surroundings, and you have to know that this is actually happening in your area where you live and where you're going to work in. And you have to be able to stand up and, and know your rights and know the patient's rights and be able to advocate for them. And I think little by little, that's how we will change the system, but we all have to come together and do that.
Can I say,
professionals?
I just want to say that also, I so appreciate where you're all coming from, but there's no but. But Carolyn, I reached out to you privately, because I'd like to talk to you, but I just think it's also so important to teach patients how to advocate for themselves.
Correct.
Because if you can't advocate for yourselves, and especially if you don't have someone, I'm lucky, I have my partner, so he's with me. But even then, the questions that you need to ask when you go to see a doctor, you really have to somehow have it together, or you can walk out and still not have a clue what's going on.
So yes, and I do that for my seniors because a lot of my seniors don't have family members here. So I will be the voice for them, and I do attend doctor's appointments. I also prepare my families for things to look for, to ask for, to not be afraid because the doctor says so. You have every right to question a doctor and what they are doing. And if they can't explain it to you in terms that you understand, then either you need a different doctor or he needs to bring somebody else in that can do that. And I've had that experience with my mother. I kicked a physician out of my mom's room and told him he was not allowed to treat her. So, just because they have, and no disrespect to San, just because they have the doctor behind them, you have the right to question. You as a nurse, number one, and your patient the best. And, it is imperative that yes, we tell families what they can and cannot do. But I think Jessica, speaking to what you were saying, is the young nurses aren't taught that in school. And some people just aren't able to take that role as an advocate to the next level and be like, you're a doctor, I don't care. I'm questioning this test or the results because my patient is not acting right. So, that's where that's not taught. And I think that should be included in nursing.
I agree 100%. I'm not sure if anyone knows Cedar Crest College back in the day. I don't know if it still is. It's an all women. It's basically
not anymore.
Caucasian. Not anymore. There's men. Well, when I started there were some men that were being allowed in, but it's predominantly Caucasian, right? In my class of 76, I was 1 out of 3 that were minorities in my class. And I don't have to speak a lot on everything that I had to go through to continue in the nursing program, but it's a private college. So guess what? They make their own rules. They get to choose if they want you there or not. You make one single mistake, you get kicked out. So could you imagine everything I had to fight for, and you think I'm not going to fight for my patients after I just went through all of that? it's one of those things that just fuels my passion even stronger to educate young nurses, that, what you learn in nursing school, yeah, that's something to take with you, but being just a human and caring for people and knowing what's right for people is what matters. It's not just your nursing license behind it. It's just caring for one another and making a change.
That's awesome. I just want to like jump into, but not to call out like Emmeline, but she's on this group chat too, or on this call too, but we go to the sales together and we're like we're about to be senior nursing students, but us too, it's like 2 out of the 3 minorities that are like in our 40 or 36 now, like nursing major students. But how, I guess like, I guess with time too, but what are some ways like you and like Carolyn as well that I can like, or us as nurses can start to get like comfortable and like knowing our rights, our patients' rights, and like advocating for them? Because like at DeSales and during nursing school, like you're right, they just teach us everything like it's like kind of like black and white situation, and like they say like advocate, like stand up for your patients, but no one's ever like, okay, well in this situation you need to know like this and this, like, yeah.
The best advice I can give you is you're gonna have to find where your passion lies, right? So wherever you decide to go after nursing school, depending on what it is, don't be scared to switch. A lot of nurses just stay there. They don't know how to just let go and move on to, if it's not making you happy and it's not your passion, please move on. There's nothing that says that you have to stay at this job for 20, 30 years. Because I've worked with a lot of nurses in the emergency room that've been there 30 years. And I've always said, why are you even here? You don't like it here. It's one of those things that as a nursing student, you have so many pathways and it's like so diverse. You can do whatever it is that you want. That's like, it's amazing to be a nurse. I encourage everyone to be a nurse, but you can select what you want to do. So you're going to be able to find yourself, and you're going to be able to know where is it that you want to advocate and where you feel strongly to work in. So, I don't know whether, is there a specialty that you want to get into, or is there a specific, area you want to work when you graduate?
I feel like every time I do a clinical, it changes, but I just did my OB clinical and I loved it. So I agree. I think nursing is amazing how like many possibilities you can go into. And I just feel like everywhere I go, I love, but I need to find a place that I'm like, this is it.
And that's why you have clinicals. That way you get exposed to everything and you're able to determine where is it that you love the most, right? And if it's OB, mother, baby, then you can advocate for those mothers that can advocate for themselves. It's one of those things you'll figure it out once you go into nurse and once you get out of nursing school. But always have that caring aspect of yourself. Don't lose that. Don't ever lose that. And I see that a lot.
And I think, Chelsea, as you grow as a nurse, the biggest thing to me is to connect with your patient. Now for me, I chose geriatrics as my specialty. So I spend a little more time, even when I was in the nursing homes and now doing home care. I got to spend a little more time, but I got a sense of who they are. And I saw in the group chat that Nikita asked about cultural competency classes, and I had it in my teaching. And that's also a very important part of how I treat my families and my clients, because I treat my client and the family. It's a unit. And so I'm aware of who they are. What are their beliefs? What did they do for a living? What kind of food? Religious, all of that I take into consideration when I treat somebody, when I am working with my family. So I think as you grow, you're going to find your groove, but just pay attention to that patient from the time you see them, day 2, whether you stay in the hospital setting, whether you go into a private practice, whatever it is, learn who that person is. And just the smallest changes can be lifesavers if you recognize that before a doctor's not going to see it. You'll see it. And maybe your CNAs or, techs in the hospital, that was always who is my eyes and ears. My CNAs and my home health aides, I rely on them to give me that information. They spend the most time, and that, that's most of the advice I can give you is you'll find your groove and just pay attention to your patients.
Thank you.
And come join community nursing. I'll take any nurse. Come shadow. I always say, shadow. You have community, right? You have a community rotation.
Yeah, it's coming up our senior year.
There you go. So, neighborhood health centers, we take students all the time from Lehigh University to sales. We take them all the time just to shadow and just get to see what we do. And sometimes they love it. We have a lot of nursing students that we hire, so please.
That's awesome. Thank you.
Community, absolutely.
Thank you all so much for the discussion and everything has been wonderful. I want to bring you all back to the chat. Carolyn kind of hinted on it, but just so that Jessica and Yahaira know, Nikita did ask, she stated that she's a social worker, and she did ask about cultural competency education, like if there's ongoing education on cultural competency. So Jessica, I guess if you have anything you want to add, I know Carolyn already spoke.
Yeah, I'm not sure where Caroline went to school, but where I went to school, no, we did not have that. We did not touch base on any of that. And I wish we would have, and I think they should have that in their curriculum. Absolutely. It should be drilled in every semester, I would say, at least as a 1-credit course, right? I think everyone would be interested in doing that. And that was a great question. As a social worker, this is something that should be implemented in nursing schools. I myself didn't go through it. I lived it, if I would say.
Right.
Yeah, no, they don't have that. As far as I know, at least at Cedar Crest College, no, there's not a cultural competency class that you have to take.
So thank you for sharing that, Jessica. The next question is from Dr. Batts, and we know that he also has a social work background, so I think it kind of piggybacks. And Yahaira, you might also be able to speak to this. He says, can we talk some about interdisciplinary teams in healthcare? How do we do team well?
Listening is number one, don't listen to respond. And as they've been, and I'm speaking as a patient, as they've been speaking as nurses, really get to know your patient. And if you feel something is off, ask about it, because, they might not want to speak on it. They might be a little unsure. Trust is everything, honestly. That's what it really comes down to. Trust is everything. And if I have an issue with, let's say, a nurse or, a doctor or whatever, because it's not a perfect world, it happens. I need to trust that the individuals I'm reaching out to, it's going to be fixed rather than become a problem. Teamwork. It always comes down to teamwork.
I can talk a little bit about that. We're moving in that transition as in team-based care model. We have 3 locations, Allentown, Bethlehem, and Easton, where we just opened up another location on Broad Street in Bethlehem, which I'm going to be overseeing as well, and I'm so excited for it. It's one of the things that we've been working on for the past, I want to say, year, as in creating our teams to take control and encourage our patients to manage their care. Not only just a quick example, when a patient comes in, let's say a 24-year-old comes in and they're being referred to endocrinology. It's one of those things where we're so used to doing it for our patients that we've had to take a step back and say, are you able to make this appointment for yourself? And if you're not, please reach out to your team and we'll collaborate and encourage to coordinate that appointment for you. Before we were transitioning into this team base, it was one of those things where we were just making appointments for all of our patients, but that's not encouraging them or empowering them to manage their care. So it's one of those things that we have to learn how to navigate our patients and be there as their support system as a team. And that's a little hard to do sometimes because, sometimes you take control of your patients and you want to just take care of them completely. You know what I'm talking about, Caroline. So it's one of those things where you want to do stuff for them, but you have to also give them that chance to take control and do it for themselves. And little by little, I've seen that it works amazing. They've taking control, and they even come to me and they say, oh, I was able to schedule this and they got me in for 2 days. And I was like, yes, that's awesome. You know, just let me know how that goes. And I always follow through just to make sure that they've gotten to their appointments and they did all that. But yes, teams are amazing if they work well, if they are actually, you have to pair up the right team. That's all I have to say. It's a lot of personalities, a lot of, you know, you just have to learn how to build your teams and learn how to do that. But yes, that's important. If that answers your question, Hassan.
Awesome. I think
Yes, it
there's
does. Thank you
also,
very much.
oh, go ahead, Dr. Bass.
No, I was saying yes, it does. Thank you very much. I just wanted to. The other thing just to add is that the patient is the lead of the team, and I've seen you work, so I know that you believe that.
Yes, so I think thank you for both for answering that and Dr. Bass for asking that question. We right now are working with the students who are an interdisciplinary team of students who are working on projects for health equity, deliverables for health equity that promised neighborhoods can use to raise awareness and education for practitioners and for community members. And so we have students who are future PAs, nursing students, future doctor. We have a future licensed clinical social worker. And so we do want to talk a lot about how all of these members, service providers in the community can work together. They are working on projects that are across housing, social isolation and mental health support, and also culturally competent providers. So I hope that they feel empowered while they are on this webinar to ask you all questions as it relates to their projects. I really appreciate what you have shared in the conversation that's happened so far. And I thank Yahaira for talking about calling out the bullshit, right? Like the systemic, like recognizing that there are real systemic issues that need to be addressed, and the power of service providers in taking a stand on those issues and recognizing that this is a very specific experience that a person who is in the brown and Black community is having based on these systems that are at play. I know there has recently was an incident, a very polarizing incident in Allentown that involved the hospital and all of these systems colliding. So I appreciate you all speaking to that. And I hope that the students feel like they can utilize this forum to ask those questions, and so that we can produce results from this webinar that can then be something the community can have. Looks like Nikita has her hand raised too, so I can ask her to unmute and ask a question.
Sorry, that was by accident.
Oh, well, we just wanted to hear your voice then.
Oh.
That's what it was. Follow your instinct, guys. You know, that's just listen to yourself and keep it real. The easiest person to lie to is yourself. Don't lie to yourself. It's an injustice.
I have a question here. How do you suggest that patients can find a provider that is culturally competent? That's a great question. Was it Noel? That's kind of hard. Again, trust, like Yahaira said, she's a patient. It's just building that trust with your provider and knowing that they're culturally competent in managing your care. I don't think there's a specific, platform for that. I would say that it's just knowing by, referral, and knowing, like by Yahaira, she posted some of the doctors that, she gave some good references there. And just all the doctors here are awesome. There's many doctors here and nurse practitioners are awesome. They're here for one reason, and that's to care for patients and to make sure that we help them and empower them to manage their care. So Neighborhood Health Centers is here.
And
If I could start you with one.
awesome. Now, sometimes we might go back to thinking, well, if they look like me, you know, it might be a little better. That's not always the case. I'm going to tell you, my OB is Dr. De La Vega with Lehigh Valley. He's delivered all of our kids, and I absolutely love him. He's a Hispanic man. Dr. Miller, that's my rheumatologist. You know, he's a little older Caucasian man, and I love him. I love his knowledge. I love the way he does things. He's a little bit antiquated, but that's okay with me. And who was the other one I listed? Oh, Dr. Lim, my neurologist from St. Luke's. He's, you know, probably a little bit older than me. He might even be younger. I don't know. But he's, I believe he's a Chinese man. But it ultimately comes down
Multicultural.
to, yes, exactly. Like how they make me feel, how they listen to me.
That's right.
You know, because that's an important thing. How they take everything that I have going on into account. And ultimately is the teamwork. The teamwork is crucial because I have too many things going on. It is not my job to bring this doctor up to date on what I have going on. So there's times I forget, you know, my seizures take my memory away. So cohesion, teamwork, all that stuff, imperative.
Absolutely. You have to create your own care team, basically, in regards to who you feel cares about your care, right? If that makes sense. It's entrusting your health in somebody's hands. Let me see, I think there's some more. Hold on, let me read over here. There's so many things going on in this chat. Let's see, as an LCSW, I'm happy to hear that there are future LCSWs. Oh, there's a lot of LCSW. I work with a lot of them. I work with a lot of LCSWs and they're awesome. And Caroline just said, this was an amazing forum. Thank you, Yahaira and Jessica, for speaking. Good luck in the future. Good luck to that. The future nurses and healthcare workers have to run to doctor's appointment for my mom. Have a beautiful day, everyone. Nikita also wrote, thank you for the wonderful presentation. You all did an awesome job. Thank you for providing such wonderful resources, and I will definitely share it with my clients. That's awesome. Let's see. I think that was it. We were just saying thank you to everyone.
Absolutely. I'm going to put the poll out. People can still continue to ask questions as they have them, but I'm going to just launch the live poll so that you all can comment. I actually forgot to do this last week, so I want to make sure that I remember to do that this week.
Hi, I have a question. Yahaira, I was really touched by your story about your encounter with that one doctor. I'm currently a pre-med student myself, and even though I have a long road before I can become a practicing physician, do you have any advice or tips for pre-meds or students who are planning to go into the medical field to help prevent situations like that from happening?
Thank you for that question, because it's huge. First of all, recognize that we all have some sort of prejudice and some sort of bias. The most important thing is to make sure that that gets left at the door before you enter to see that patient. As I've had to tell other individuals, like, you come into this room and I'm just a quick 15 minutes for you, but you have been my 3-month wait. I have been waiting to get this diagnosis, this, whatever it is I've been waiting so long for. What is just 15 minutes to you is what feels like a lifetime to me. So just be courteous of your patient's time. Leave any and all prejudices at the door, because like I said, we all have them. And always put your patient first. That question gave me goosebumps. You're going to be amazing. That was, thank you, because it's everything. It's everything. It sets, you know, your demeanor. It sets how you're going to do things. It's everything. Thank you so much.
Thank you for answering my question. I really appreciate it.
You're welcome.
Yeah, I appreciate Philip for asking that question as well, as one of the students, and I wanted to see if the two of you had any feedback on ways that you feel like healthcare providers and service providers can de-escalate situations in more culturally competent, trauma-informed ways, because I think what I heard from Yahaira's story and also what I saw in, you know, the video that was released of what happened in Allentown was a lack of awareness and kind of the way that racism plays out and how people respond to folks of color when there's an issue, right? And what are better ways, if you all have any suggestions, that people can, because sometimes there are problems, right? Sometimes there are problems and we need solutions. So what are the ways that a person could have responded to you differently because you were angry and you had the right to be angry, Yahaira, but what could they have done differently in that moment?
The nurse could have not taken it personal, because that's what happened. I called them out on an action and she took it personal. Therefore, my medical care went out the window, and it was almost like a personal revenge sort of thing. Instead of taking a step back, putting herself in my position, in my shoes, and saying, you know what, I wouldn't want to lay in that bed for 3 to 7 days either, not knowing what the stuff is on here, or, you know, things like that.
If not, apologize and said, I'm so sorry. Let me address this with my supervisor and let's see what we can do about it. I'm so sorry this is happening. I should have realized this before even putting you in the room. There's a lot of things that we have to keep in mind, mindful. And I don't want to speak about that video because I'm still so angry about it, because I used to work there. So, and I tell myself every time I see that video that occurred at Sacred Heart, I tell myself that if I would have been there, it probably wouldn't have happened. So it's one of those things that we have to be mindful, and we have to take control, and we have to know our patients' rights and our rights as patients, as you know, as employees as well. You know what you're supposed to be doing at your job. You're supposed to take control and not let anybody else tell you what to do to a certain extent, regardless if, you know, I'm not saying to overstep your superiors. I would never say that, but you know where you stand and you know what you have to do. So it's one of those things that, you know, you just have to be mindful. And you're right, Yahaira, that nurse should have taken control, because nurses are the ones that are always there. And we know our patients. We know our patients more than doctors. Doctors go in, give a diagnosis, and I'm not discrediting a lot of doctors, but the patients trust us the most. And the minute, the minute she took it personal, you're right. Your care went out the window. You are absolutely 100% right, because now she took it as a person of vendetta. Right. And it's almost like, let me go to my supervisor and say whatever the heck she felt like saying. And that's why he came in with that demeanor. And she could have handled that so much differently. And I'm sorry you went through that.
Thank you, babe. Appreciate you.
Sorry, but yeah. Any more questions out there?
This poll is awesome. Did you see this, Jessica?
No, I have not seen the poll. I don't know where to
Thank you. They gave us like an A.
Yeah.
Yay!
That's awesome. Oh, I see it.
Yes. Yes, you all
That's
have,
awesome.
This has been an awesome webinar. We appreciate you so much. Thank you so much for sharing your personal experiences and talking about from your expertise. And I know that this was extremely useful to everyone who was on the call. So we're very grateful to you all.
Thank you.
If there aren't any more questions, then Julie, she has a wrap up that she does to announce next week. And then we can go ahead with that.
Yeah, and I just want to again say thank you. Thank you so much. This was so informative. You two women rock. Really appreciate it. And next week we are having another interesting topic, and our presenters are terrific. It's called Countering The Conspiracy to Destroy Black Boys, Interrupting the School to Prison Pipeline, and Freedom Schools with Pastor Gregory Edwards, Darian Colbert, and Justice Simpson. So you are all in for a treat next week. Going to be very different than this, but just as wonderful.
Can't wait. Good stuff.
So thank you. Thank you all. Have a great week.
You too. Thank you for this forum.
Thank you,
Empowering.
everyone.
Great.
Thank you,
All
everyone.
right, everybody, take care.
Thank you.
Bye-bye.
Thank you.